Overview: many cancers have 4 stages, but small cell lung cancer, SCLC, is generally divided into 2 stages, limited stage and extended stage. Knowing the stage gives you some idea about the general outlook and what to expect from treatment. When deciding on the next steps, the stage isn't the only consideration. Your doctor will also factor in your age, overall health, and personal preferences regarding your quality of life. Read on to learn more about what it means to have extensive stage SCLC. Extensive stage SCLC. Extensive stage SCLC has spread far from the original tumor. Your doctor will diagnose extensive stage SCLC when the cancer is widespread throughout one lung, has spread to the other lung, has invaded the area between the lungs, has reached lymph nodes on the other side of the chest, has reached bone marrow or distant sites such as the brain, adrenal glands, or liver. Because there often are no early symptoms, about 2 in 3 people with SCLC have extensive stage disease at the time of diagnosis. Recurrent SCLC is cancer that has returned after treatment has been completed. Treatment for extensive stage SCLC: chemotherapy. Because the cancer has spread, the main treatment for extensive stage SCLC is chemotherapy. Chemotherapy is a type of systemic therapy. It doesn't target a specific tumor or area of the body. It seeks out and attacks cancer cells no matter where they are. It can shrink tumors and slow progression. Some of the more common chemo drugs used for SCLC are carboplatin, cisplatin, etoposide, irinotecan. Usually, 2 drugs are used in combination. Immunotherapy. Immunotherapy drugs like atezolizumab can be used in combination with chemotherapy, as a maintenance therapy, or when chemotherapy is no longer working. Radiation in extensive stage SCLC. Radiation to the chest is usually only done if you have a good response to chemotherapy. Radiation therapy can be used to target specific areas of the body where cancer has spread. This can help shrink tumors to improve symptoms and potentially prolong your life. Even if the cancer hasn't spread to your brain, your doctor may recommend radiation to the brain, prophylactic cranial irradiation. This can prevent the cancer from spreading there. Cancer in the lungs can lead to bleeding and trouble breathing. When that happens, radiation therapy or laser surgery may be used. The goal isn't to cure it, but to improve your symptoms and overall quality of life. Clinical trials. SCLC is difficult to treat. You might want to consider clinical trials of new chemotherapy agents, immunotherapies, or other treatments that aren't otherwise available. If you're interested in learning more, your doctor can find out what trials might be a good match for you. Supportive therapies. In addition, you may need supportive, palliative care to address specific symptoms. For example, bronchodilators to widen the airways of your lungs, oxygen therapy, pain relievers, corticosteroids, gastrointestinal medications. You can also work with a dietitian for nutritional support. Outlook for extensive stage SCLC. Chemotherapy can be effective at shrinking SCLC. Many people will experience some symptom relief. Even if the cancer shrinks to the point where imaging tests can no longer locate it, your doctor will likely suggest maintenance therapy. That's because SCLC is an aggressive disease that almost always returns. While there is no cure for extensive stage SCLC, treatment can help slow progression and improve your quality of life. Choosing treatment. There are many standard treatments for extensive SCLC, and many things to consider. In addition to the stage, your doctor will recommend treatment based on where the cancer has spread, metastasized, and what organs are affected. Severity of symptoms. Our age, personal preferences. Chemotherapy and radiation can lead to significant side effects, even in the healthiest of people. Your overall health will guide decisions about chemotherapy drugs and dosing. Set aside time to have an in-depth discussion with your oncologist. It may help to involve family members or other loved ones. Get a good idea of each type of treatment, what you should reasonably expect of them, and likely side effects. Ask about the logistics of treatment and how it will impact your life on a day-to-day basis. Your quality of life matters. What you want matters. Encourage your doctor to speak plainly so you can make good decisions. If chemotherapy or clinical trials aren't a good fit for you, you can still continue to receive supportive care. Rather than try to cure the cancer or slow progression, supportive care focuses on symptom management and maintaining the best quality of life possible for as long as possible. Living with extensive stage SCLC. Living with extensive stage SCLC can be overwhelming. But there are ways to cope with the disease and live your life to the fullest. Some people find it helpful to see a therapist to help sort out their emotions. This can also be beneficial for loved ones who are having difficulty. By joining a lung cancer support group, you can connect with others who understand what you're going through. Your doctor or treatment center can refer you to these services. Getting treatment is important, but it's not the only thing to consider. Treat yourself to activities that are meaningful to you. You deserve it and it will contribute to your quality of life. Takeaway: extensive stage SCLC means your cancer has spread far from the tumor. There is no cure for this type of cancer, but treatment is available to help manage symptoms and prolong your life. Your doctor will recommend a treatment plan based on your diagnosis and overall health.